Hi, I am Dr. Rajat Kandhari, consultant dermatologist from Dr. Kandhari Skin and Dental Clinic, New Delhi. Today we'll be discussing some of the frequently asked questions associated with hair fall and some of the common myths associated with it. First and foremost, one of the commonest scenarios that I face in my clinic, Doc, I'm losing clumps and clumps of hair. There's hair on my pillow, there's hair in the shower drain. I think I'm going to go bald. Well, this is a condition called telogen effluvium. And the good part is you're not really going to go bald. This will settle down. Telogen is the resting phase of the hair follicle and anagen is the building phase. And at a given point in time, 80% of our hair are in anagen and 20% of our hair are in telogen on the scalp. In this condition, this ratio gets reversed and more hair go into telogen and hence start falling off as compared to being in anagen. The common causes associated with this kind of hair fall are pregnancy, crash dieting, direct insult to the hair in form of straightening, rebonding, and other procedures, further nutritional and iron deficiency anemias, and fevers such as typhoid fever, dengue fever, as well as chikungunya. These are common causes which can trigger this hair fall. Typically, this hair fall will occur 3 to 4 months after the insult. Once the insult is perceived by the body, the same insult is perceived by the hair. And this triggers the hair to go from the building phase, which is anagen, to the telogen phase, which is the resting phase. And this takes typically 3 to 4 months. The good part is this will typically settle down and the patient will be fine with minimal treatment as well. We just need some hair supplements as well as minimal treatment which will help this kind of hair fall. This kind of hair fall is sometimes mistaken for thinning of hair, which is called androgenetic alopecia or genetic hair fall. Androgenetic alopecia is driven by hormones or androgens such as testosterone, which is converted into dihydrotestosterone, the active form. And this causes thinning of hair and hence some scalp show, which will not happen in telogen effluvium, wherein you will have an alarming fall of your hair but no thinning of the hair. The second common scenario that I face in practice is, Doc, I'm fed up of my dandruff. I keep oiling my hair, but my dandruff just doesn't go. Well, here's the truth. Oiling does not make dandruff go. Well, at that time maybe it does and removes the flakes, but there is a fungus which is implicated in dandruff and this is known as Malassezia furfur. This fungus is lipophilic, means it loves oil. So I typically tell my patients that if you're going to keep applying oil overnight, the fungus is going to have a party and your dandruff is going to keep persisting for a long period together. So if at all you want to oil your hair, do it on a weekend. Do it for 2 hours and then wash it off. So the next question you'll probably ask me is, so should we not oil our hair at all? Well, this is a practice which is very prevalent in the Indian subcontinent, oiling of the hair. Oil is a conditioner for your hair. So like I said previously, if at all oiling must be done, it should not be done overnight as it can lead to dripping of the oil on your forehead and leading to pimples as well as breakouts. So you may oil your hair on weekends, do it infrequently, do it for a few hours and then wash it off with a good shampoo. Other common myths associated with hair fall are, Doc, I've gone bald twice, but my hair just doesn't seem to get fuller or grow. Hair is a non-viable tissue. Cutting your hair is not going to make it thicker, grow fuller or increase in volume, period. Doc, I have just shifted houses and because of the hard water, I'm losing a lot of hair. Well, hard water cannot be the only cause of your hair fall. Sure, it can lead to a reversible sort of minimal hair fall and coarse texture to your hair, but it won't lead to pathological hair disease or hair fall. And there is nowhere in Delhi NCR where there's no hard water. Doc, I have to wear a helmet the whole day or a hat the whole day and that's leading to my baldness. Hair follicles need oxygen, but they get that oxygen from the interior, that is from the blood supply at their bulb. So unless you wear a very tight hat or a helmet, or which is leading to excessive friction, which may cause a little amount of hair fall known as tractional alopecia, otherwise there is no reason that hair follicles will lead to a loss in them due to your hats or your helmets or a thinning of the hair. So you're all good if you have to wear a hat or a helmet even the whole day. So what can one do to prevent these sort of things and take care of your hair? If you do experience any of these conditions, please visit your dermatologist at the earliest. Eat a well-balanced diet, stay well hydrated, steer clear of excessive procedures for your hair and hair care products. You may oil your hair, but oil it once a week. This will act as a conditioner and protect your hair and nourish your hair shaft. And last but not the least, just relax and take less stress. I hope this has cleared your doubts associated with hair care. Please take care of your beautiful and gorgeous hair. They are important and they give you confidence.